Two security officers ordered the old cleaning lady to get out when the mass shooting victims started arriving. Maria had been invisible for 8 years, just another immigrant mopping floors while real doctors saved lives. What they didn't know was that she'd already saved more lives in combat than their entire hospital staff combined. The gunshots had ended 20 minutes ago. Now the real crisis was beginning. All cleaning staff out, Security Chief Williams barked. We need space for actual medical professionals, not old ladies with mops. Maria Santos looked up from mopping as ambulance sirens screamed outside Memorial Hospital. The first wave was arriving, dozens wounded from the downtown office shooting. You deaf, Grandma? Williams grabbed her mop bucket. Real doctors need to work. Go home and let the professionals handle this. Through the trauma bay windows, Maria could see chaos beginning. Dr. Harrison was preparing for what looked like the worst mass casualty event in hospital history. Move it, Maria, Charge Nurse Patterson snapped. This isn't cleaning time. Medical emergencies require people with actual training, not immigrants who barely speak English. The casual cruelty hit like a slap, but Maria was used to being dismissed. 8 years of night shift invisibility had taught her to swallow pride for steady employment. The first ambulance crashed through emergency doors. Maria watched paramedics rush in a young woman, blood-soaked, unconscious from blood loss. Second ambulance, middle-aged man with chest trauma, gasping for air. Third ambulance, 2 teenagers with abdominal wounds, both screaming. Jesus Christ, Dr. Harrison muttered. Peterson, how many more incoming? At least 30 more casualties, multiple severe trauma. We're about to be completely overwhelmed. Maria counted medical staff, 2 trauma surgeons, 4 emergency physicians, 8 nurses, maybe enough for 10 critical patients, not 37 with life-threatening injuries. Clear this hallway, Dr. Harrison shouted. No unnecessary personnel. Williams spotted Maria still watching. What did I tell you, old woman? Out! We need space for medical equipment, not cleaning carts. Ma'am, leave immediately, Nurse Patterson added with visible disgust. We can't have untrained people in the way during real emergencies. Untrained people. Maria had heard that dismissal before, in different circumstances, when being Latina meant proving herself twice as hard. But as the 4th ambulance arrived with 3 more critical patients, Maria's mind began performing calculations she hadn't used in 8 years. Triage mathematics from field hospitals, where decisions meant soldiers living or dying. Arterial bleeding in first patient, maybe 15 minutes before irreversible shock. Chest trauma in second. Developing pneumothorax, 20 minutes before respiratory failure. Both teenagers had internal bleeding, one more critical than the other. Dr. Harrison was managing 6 critical patients, while Dr. Peterson performed emergency surgery. Nurses ran between patients, starting IVs and controlling bleeding, but there weren't enough qualified hands. We're losing the girl, Patterson called. She's in shock and I can't get a stable IV. Maria watched the 17-year-old's blood pressure drop and heart rate spike. Classic hemorrhagic shock from arterial bleeding that should have been controlled immediately. The kind of wound Maria had treated dozens of times when helicopters brought in soldiers with shrapnel damage, and there was no time for hesitation, no room for doubt. I can help, Maria said quietly. Ma'am, get back! Williams blocked her path. Medical personnel only! She's dying, Maria pointed to the teenager. Arterial bleed, approaching irreversible shock, needs immediate pressure point control. Lady, you mop floors, Williams said with contempt. Leave medical diagnosis to people with actual education. But Maria was already moving. 8 years of cleaning had taught her every supply location, every route through the hospital. She moved past Williams, past Patterson's protest. Security, Patterson shouted. Remove this cleaning woman! Maria reached the 17-year-old whose parents were crying. The girl was pale, cold, sweating, advancing shock that would become irreversible within minutes. Maria grabbed pressure bandages and applied direct pressure to the arterial bleeding with precision of someone who'd performed the same procedure under rocket fire when American soldiers were dying. What the hell are you doing? Dr. Peterson demanded. Controlling arterial bleeding, Maria replied calmly. Pressure point technique, IV access for fluid resuscitation. The bleeding stopped. Maria established IV line with efficiency of someone who'd started hundreds in field conditions where sterile technique was luxury and keeping patients alive was only priority. How did you know that? met. Dr. Peterson stared as the girl's blood pressure stabilized. Army Combat Medic, 68th Combat Support Hospital, Iraq and Afghanistan. 8 years active duty. Dr. Harrison looked up from his patient. Did you say combat medic? Yes, doctor. Sergeant Maria Santos. Trauma medicine, field surgery, mass casualty triage. The room went quiet except for medical equipment sounds and patients' moans. How many mass casualty situations? Dr. Harrison asked. 17 major incidents, helicopter crashes, convoy attacks, base raids, maximum 43 casualties in single event. Dr. Harrison looked around his overwhelmed trauma bay. Maria, I need triage assessment on incoming patients. Can you perform field protocols? William stepped forward. Doctor, she's just cleaning staff. She's a trained combat medic with mass casualty experience. Dr. Harrison cut him off. Right now, she's the most qualified for what we're facing. 5th ambulance arrived with 4 more victims. Maria moved towards stretchers, shifting from invisible cleaning lady to combat medic managing crisis where lives hung in balance. This one first, she told Dr. Peterson, indicating abdominal trauma. Internal bleeding, surgical priority within 10 minutes. This one monitoring bay 2, regarding shoulder wound. Painful but stable, can wait 30 minutes. This one immediate intervention, about chest trauma. Developing tension pneumothorax, will collapse in 15 minutes without decompression. Dr. Harrison watched Maria perform rapid assessments with efficiency of someone who'd learned medicine, where quick decisions meant difference between soldiers coming home alive or in body bags. Where did you learn surgery? He asked between patients. Combat hospitals. When nearest surgeon is 100 miles away and helicopters can't fly, medics perform whatever surgery necessary. Independent surgery? Yes, sir. Field conditions, limited supplies. Not optimal, but soldiers survived. 6th ambulance brought 3 more critical cases. Maria continued triage while Dr. Harrison realized this woman who'd cleaned around him possessed medical experience he'd only read about. Maria, patient in trauma 3 needs immediate chest surgery. I'm committed to abdominal case. Are you current on emergency procedures? Trauma surgery? Yes, sir. Chest tubes, bleeding control, emergency procedures. Scrub in. OR2 available. Patterson looked shocked. Doctor, she's not licensed. She's combat medic with surgical experience, and I have more dying patients than I can handle, Dr. Harrison replied. Her training will save lives. Maria scrubbed with methodical precision learned in military hospitals, where infection control meant difference between soldiers returning to duty and dying from complication. Patient was construction worker with penetrating chest wound that collapsed lung and caused internal bleeding. Trauma Maria had seen in soldiers hit by IED shrapnel, where minutes determined survival. Maria's hands moved with muscle memory. Chest tube insertion, surgical exploration, repair of damaged tissue. Techniques learned when American lives depended on her skill and hesitation meant death. 2 hours later, 37 casualties treated at Memorial Hospital. All 37 survived. Dr. Harrison found Maria at 3 a.m., exhausted but steady. Why cleaning work with your medical background? Maria looked at hands that spent 8 years saving soldiers, then 8 years trying to forget medical responsibility weight. After Army, wanted peaceful work. Cleaning is quiet, no life or death decisions. Tonight you made decisions that saved 37 people. Some training never leaves. When people dying, training becomes reflex. I want you on emergency medical team. Your experience, skills, we need you. Not licensed physician. You're combat medic with trauma surgery experience. Certification pathways exist for military medical personnel. I'll help with transition. Maria considered 8 years, choosing invisibility over responsibility, being dismissed as just cleaning staff. People die if I make mistakes. People lived because of your training. All 37 survived because you were here. Next night, Maria returned to cleaning shift. Same uniform, same routine. But medical staff now looked at her with respect instead of dismissal, because some skills are earned where every decision matters and failure means death. And sometimes, when lives threatened, those skills surface regardless of uniform worn. Every story is earned, not given. And some earnings save lives when respect is finally earned. If you enjoyed this story, click the like button and don't forget to subscribe so you don't miss the next one.